So welcome to module 5 of the Little Brushes Guide. Now today we're going to talk about the interdental cleaning. So interdental cleaning is not that relevant for children up to the age of 6 because milk teeth usually have a lot of gaps in between them. It's because the milk teeth are much smaller than the adult teeth, and also the jaws are growing, so the milk teeth are made in such a way that when they are replaced by the adult teeth are much bigger than the milk teeth, and also the jaws grow. So very unlikely that children will need to clean in between the teeth with their milk teeth. But if you feel like they are having the decays usually happen in between the teeth, and if there's a high decay rate or a high sugar content in children, then it's a good idea to floss the milk teeth as well, especially the back ones. And all the front ones usually have gaps in between them, between the two molars on each of the quadrant. I recommend floss. So now interdental cleaning. So how the teeth is that the teeth meet and contact at one point. It can be a contact point or a contact area. If the tooth's overlapping, there's a big area of contact, and this is the only area where your toothbrush cannot get in because it's a really tight contact point, and this is where the bacteria sits hiding away from your toothpaste and your toothbrushes, and it waits for sugar. The minute it gets sugar, it stays in these areas and starts causing decay. So this is one of the most common areas where you get decay, in the contact points and in the deep pit and fissures. And that's the first point in between the teeth. The second is the gaps underneath the contact point. The gaps can be really small, big, wide like that, or really like that. All sorts of shapes and sizes. So when the adult teeth starts coming up into the child's mouth from the age of 6, and you get a full set of adult teeth by the age of 13, it is really the most difficult time to clean the teeth because of reasons we have already discussed before. The cleaning in between the teeth is quite crucial, and this actually makes up to 40% of your tooth surface. So imagine you have a plate and you don't clean 40%. Will you eat from that plate? Same way, you've got your teeth, 40% is not cleaned if we don't clean the interdental, the contact point and the interdental spaces. So it's really a good idea to clean it. Also because most of the dental decay and most of gum disease starts from this gap in between the teeth, so we want to try and really clean it. The interdental cleaning is advised as the first point of cleaning for the teeth. So as brushing regime wise, I recommend we floss first, then you use the interdental brushes, then we clean the tongue, and then we use either a mouthwash at this point if you wanted to use a mouthwash, or a water flosser that just flushes out all the bacteria that we have sort of loosened out from that area, so it doesn't go and get collected back into the area quickly enough. And then we use an electric toothbrush and toothpaste. Spit out, don't rinse your mouth out, and leave your toothpaste in. So that's the regime that I recommend for brushing, for oral hygiene, not just brushing, the oral hygiene. Now, first, let us talk about dental floss or dental floss picks. So I recommend the dental floss picks for everybody because sometimes what happens is people put the floss in, and I've seen they pull it towards one tooth or more towards another tooth, and instead of cleaning out, imagine trying to clean a triangle like this efficiently with a piece of string. What you have to do is you have to put it in, take it towards one tooth, take it back out, back in the same gap, keep it towards the other tooth, take it out. It is quite a hard one to do, the whole triangle. So I don't recommend flossing for cleaning out the gaps in between the teeth. It's literally only to clean this contact point. So you don't want to use a string floss and sort of floss it in and floss it out. You want to sort of ease it in and ease it out. I have given videos of how to floss on my YouTube channel, which I shall try and link on the bottom of this as well. So my recommendation is guide floss. I like the fact that it's quite a thin, like the floss comes as a round string or like a flat string, and I like the flat string ones where you can ease it in easily and ease it out easily. The one thing you need to remember with flossing these floss sets or these floss sticks is that if there's any part where you have a filling, so if your child's got a filling and it does get caught, you don't want to pull it out like that. So then in those areas you still need to floss. So then you use a string floss that you cut and use. So you got to try and hold the floss tightly in between your fingers. I'll be doing another video for all the techniques. And then you take it in between the teeth, then pull it out onto the side. Don't pull it back up or out. So you ease it in and then pull it out on the side. So that is what I would recommend for flossing. Anywhere in the mouth, it gets caught either on an old filling or on your crown or any restoration that's there in the mouth. I wouldn't recommend that. So the one on the top is like a Y-shaped floss. The second one is also a Y-shaped floss. There are a few different types, any of the floss sticks, I'll just give you a couple of options. The interdental brushes, I'm sure that you must have seen. Interdental brushes is considered as gold standard for cleaning in between the teeth. These are little brushes that go in and out of the teeth. They've got bristly brushes. They're in different sizes. Most mouths need 2 or 3 different sizes to clean between the teeth efficiently. I recommend giving it a bend and then using it. I will be doing a video on techniques so that the camera is focused on to what I am doing for you to understand it better. There are the easy pick ones. This is a rubbery tip interdental brush. It's again very easy to use, and I recommend that for the front of the mouth. If you are got very tight spaces and you don't want to push at your gum with anything, because the gums, it doesn't like it being attacked, and so it will shrink away. So to avoid that, I would recommend using the rubbery tipped ones in very small tight spaces towards the front of the mouth. The back of the mouth, I always recommend, evidence shows bristly interdental brushes is the best or the gold standard for cleaning in between the teeth. So always get an assorted pack of all the colors. Initially, for the first 2 or 3 weeks, you need to stand in front of the mirror, make sure that you can check which goes in where. Try the smallest one, and then if it's loose in 1 or 2 areas, just go back there in that area with the next size up, and then if you need an next size up. So after about 2-3 weeks, okay, it's pink most areas. I need a red in this area, I need a blue in this area, and you get an idea after about 2-3 weeks of using it. So it's got to be a snug fit, not too tight, not too loose, and that's a good option to help in looking after the teeth. The water flosses, they are just pressurized water flosses. So it's like, after rinsing you're using a scourer on your teeth, you are rinsing out with forceful water. It's the same thing. This is only as an adjunct to the gold standard, that is interdental brushing. But the recent studies have shown a lot of evidence to show that water flossers work very well for people who've got gum disease, people who've got orthodontics or braces, and people who've got implants. So this may be something that for children who's got braces, you still have to physically remove the plaque, but you can flush out the plaque as well with this one of the water flosses. Water flosses I recommend there are quite a few options now in the market. All of the evidence is based, I think, on Waterpik, or all the most important evidences are based on the Waterpik brand, but there are lots of options now. So there's a cheaper option which I have given you on here, but the evidence is based all on the Waterpik one. Mythbuster: flossing or toothpicks are used to clean or loose food stuck in between the teeth. Wrong. Floss is used to clean the interdental contact point to reduce decay and is advised to be done once a day. So another pro tip is dental plaque is not passive. So dental plaque, people think, it's just, some bacteria. No, it's a thriving community. They've got lots of mechanisms in which they avoid it being brushed away. They produce their own food. They produce their own polysaccharide to hold each other together so that it's not brushed away. They absorb the calcium and they become hard so that it's not brushed away. They have a barrier, so they absorb the sugar from outside into the plaque near the tooth, and then they convert the sugar into acid, and then they have a way in which they provide the acids from leaching out. They hold the acids in contact with the teeth so that the acids demineralize the enamel so that they can, enter into the enamel. So they are like a proper flourished community. They communicate with each other. There are different types of bacteria. So like how in a community you have a butcher, you have a florist, same way the bacteria, they all work together in harmony to try and attack your enamel. So the fight is against you and your plaque. So who's going to win the battle? if they win, they make a decay on your teeth, and you don't want that. So dental plaque is not passive. It's a thriving community of both decay causing and gum disease causing bacteria, and they are the culprits behind 80% of the problems experienced in the mouth, and their plaque forms and matures every 12 to 24 hours without brushing their teeth. So that is all about the interdental cleaning, and I shall see you back in another module with the rest of the oral hygiene instructions.